Sure. My name is Becky Larsen, and I'm an audiologist. I'm currently working at Indian Health Services on the Navajo Nation Reservation. I received my bachelor's degree from Arizona State University, and I then received my graduate degree from Utah State University. And I'm also a CODA, a child of deaf adults. I'm very proud of that. So the Kayenta Health Center, KHC, has opened a new facility 2 years ago in July 2016. And at the time, the services were fairly limited. But with the new facility, they have expanded to 3 new services. One is physical therapy, also podiatry, and audiology is the 3rd service they've added. There was no audiologist services previously in that area. They had to travel to Flagstaff to receive those services, or Tuba City. And so it was quite a trek to get those services. So to have those close by is wonderful. The services we provide include hearing testing from birth through adulthood to age 99 or above, if they're still with us. So the testing, if we find a hearing loss, then we can provide hearing aids, counseling, and for those who require more assistance than just hearing aids, if that's not enough for them, if they need a cochlear implant or a special device called a bone conduction device, then we can refer them to a specialist that can cover those services. So we have connections with those audiologists who are able to provide that and they can serve our patients. Sure. Most health centers try to follow that type of patient-centered care. The reason why we want to do that, we want to make sure that all of our patients are receiving what they need from their health care, and that they're able to understand the services and understand what's required ongoing. For deaf and hard of hearing patients, it's very important. They have specific communication needs, and so we need to make sure that they clearly understand what they need. And I'm working with our medical provider as well who works with children and adults to make sure that we are serving the deaf and hard of hearing communities in ways that they understand and that show value for them. So we want to be able to make sure that they have access to communication. And so my clinic recently opened in September, and the community is very excited. People are happy to come because they've never had that before. And so I have 2 days a week working with children, and I work as well with another doctor, Dr. Gina Petard. So what's great about her is she's got a hard of hearing daughter, and her husband is hard of hearing as well. And her daughter is now attending Gallaudet University. It's her 2nd year. So her background and my background mesh well together. We know what we want to do for the community. So we want to know how we want to help those families with deaf children. We want to make sure that we're exposing them to all of their options and all of the opportunities that they have available to them. So that's exciting, and we're expecting to do more with that in the future. And also I want to add information about our oral rehab classes that we've got for adults because a lot of times with hearing loss, they grow up hearing and speaking, and they have no community, and they become isolated. And so hopefully we're not just giving people hearing aids and that's all they get and see you later. We're trying to develop more of a community with those people, to create some connections and help people who understand each other be connected to each other and provide resources for them to stay connected with the community. So that's an important part of what we're doing as well. Yes, we do. We attend different community events, health fairs, etc., local school districts as well. We will go in and set up information booths, and the school districts, middle school, tend to have career day, so we'll go there and give out information about how to become an audiologist, what's involved, as well as information about how to become an interpreter. Because I'm also a certified interpreter, and people are always fascinated with American Sign Language, so we'll bring the ABC cards and they'll learn a little bit of sign language and more about that. And we'll also be involved in health fairs for employer groups, etc. in the area, and senior centers, things like that, provide information. In addition, I teach ASL, sign language classes, at the hospital. So a lot of the employees come to my class for a variety of reasons. Some of them have deaf people in their family and they want to learn sign language. And some people, as I mentioned, Dr. Pittard, her daughter is now learning ASL for the first time at Gallaudet. So both of her parents are also in my class so they can learn. So it's really cool. And what's more unique about that is our community member, Kayla Black. She is deaf, and she is involved in helping me teach the class. And I love that. Good question. So if you want to know where to go for services, you can go to the website ihs.gov, and when you get to the site, you'll see at the top there'll be a section for patients, and then that'll give you a drop-down menu, and you'll choose your location from that. You can type in your address rather, and the map will populate with different areas, and then you can call to find out if that area has an audiologist service, or department rather, and then you can make an appointment with that provider and see what services they provide. Most of them do have audiology clinics, and they may have different requirements for providing hearing aids, so those might vary, so you can call around and find out what they provide and how to get services.